The top stories tonight in Y News. The Philippines ranks 14th in the world on total COVID-19 cases as the country recorded its second highest cases in a day.
Vaccine expert panel to decide next week on COVID-19 booster shot.
Closely on the transactions made by the procurement service of the Department of Budget and Management with formerly Pharmaceutical Corporation.
The Senate defends investigation on government agencies as Senator Manny Pacquiao asks President Rodrigo Duterte to stop defending department secretaries.
Japanese Prime Minister Yoshihide Suga to resign amid criticisms over the government's response to COVID-19 pandemic.
And sensory tools help struggling moms with postnatal disease, according to a study.
Good evening, Philippines and the world. Today is Friday, September 3, 2021. Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am Herlene Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts in our website, untvweb.com. I'm Angelo Castro III.
First in the news. The country has logged its second highest COVID-19 cases in a day. But despite this, the palace has turned down the proposal of the Octa Research Group to impose a 3-week hard lockdown in COVID-19 hotspots, saying the measure could result in more people going hungry. Rosa Licos will tell us why.
The Department of Health recorded 20,310 new COVID-19 cases today, September 3. But despite the growing number of infected individuals, many of those who had contracted the virus have recovered. President Rodrigo Duterte attributed this to the health workers.
And that is a very good reflection of what our health people are doing. And I would like also to commend Secretary Duque for that.
According to the DOH latest case bulletin, more than 1.8 million people have already recovered from the infection. However, based on Johns Hopkins University CSSE tally, the Philippines is now 14th in the world when it comes to total number of infections. The Interagency Task Force on the Management of Emerging Infectious Diseases, meanwhile, is finalizing the recalibrated response against the current COVID-19 situation in the country. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The Private Hospital Association of the Philippines welcomes the proposal of the Labor Department to give private healthcare workers additional 5,000 pesos every month. Be Happy President Dr. Jose de Grano said this would help solve the problem of lack of staff in some medical institutions.
Malaking may tutulong yan para maengganyo sila na mag-stay din dito sa Pilipinas at hindi na pumunta sa abroad.
Dole hopes the lawmakers will approve the measure and make the budget available for this by next year.
Siguro po during budget deliberation, budget hearing, baka kaya pa po naming maihirit through congressional initiatives po or special provision po para man lang meron pong mailaan sa 2022 budget na additional incentives or allowance po para sa ating mga healthcare workers in the private sectors.
The Health Department says unless the national and local government units beef up COVID-19 measures to cut virus transmissions, daily COVID-19 cases in Metro Manila may reach to 16,000 to 43,000 cases a day by September 30. Aiko Miguel reports why.
Department of Health spokesperson Undersecretary Maria Rosario Vergere says their projection is based on the impact of the more transmissible Delta variant. The assumptions used includes mobility, public health and healthcare capacity and system, and the public's adherence to the minimum public health standards. Undersecretary Vergere also explains that their projections are not cast in stone and will be used to guide authorities for better COVID-19 response.
Even though we have this kind of community quarantine restrictions, nakita natin na pataas ng pataas pa rin ang projections natin, and that is the characteristic of the Delta variant. Kaya po namin pinapaulit-ulit sa inyo mula pa nung umpisang nakadetect tayo ng Delta variant that we will expect a rise in the number of cases and it's going to be exponential.
However, Undersecretary Vergere also said that the projected number of daily cases is not absolute. The DOH calls on the national government and local government units to lower the interval between case detection to isolation. Public's adherence to the minimum public health standards should also be strictly monitored. Furthermore, vaccination, especially in the National Capital Region, the country's epicenter of COVID-19, should be intensified. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The emergency use authorization of Moderna vaccine for ages 12 to 17 years old has been approved by the Food and Drug Administration. But the government is still studying the possibility of vaccinating minors. Marvin Calas will tell us why live. Marvin, go ahead.
Yes, Diego, the Philippine Food and Drug Administration clarifies that although the emergency use authorization of Moderna vaccine for ages 12 to 17 has been approved, the government has yet to decide when to start the vaccination among the minor age group.
Yun pong pagpa-prioritize kung sino po ang babakunahan at kung anong age group ay sa Department of Health po yun, tsaka sa task force ng vaccination. So kapag na-decide na po nila na aabot na tayo dun sa prioritization na aabot na po sa less than 18, yung 12 to 17, doon po magbabakuna na ng mga bata.
Ito po ay pinag-uusapan, hindi natin sinasara ang ating pintuan para dyan. Meron na rin pong initial recommendation na rin naman. At sabi nga ni Secretary Galvez, once supply stabilizes and we can ensure na yun ating mga priority sectors ay mabibigyan na, maaari na po nating i-consider ang booster at saka yung vaccinations for children.
Vaccine Czar Secretary Carlito Galvez Jr. has recently said that the inoculation among children ages 12 to 17 years could start in October this year, depending on the vaccine supplies in the country. Meanwhile, FDA Director General Undersecretary Eric Domingo has assured that although there are side effects for using the FDA-approved vaccines, which they have monitored, such cases are rare and have a small chance of happening. That's our latest live. Back to you, Diego.
Thank you, Marvin Calas, for that live report. Vaccine expert panel considers adopting COVID-19 booster shots. The group plans to decide on the matter next week. Asher Kadapan Jr. will tell us why live.
Being infected by the contagious coronavirus disease. With this, the group is studying if booster shots may indeed curb the spread of the deadly virus. This while the country faces shortage in COVID-19 vaccine supply and more citizens have yet to be vaccinated. Based on the latest data available, over 14 million people in the country have already been fully vaccinated. This is far from the government's target of 70 million adult Filipinos to vaccinate against COVID-19. In a television interview, Dr. Nina Gloriani says the panel are on continuous talks about the matter. She also confirms that they are to decide on whether to approve adopting the booster shot or not. If approved, medical frontliners will be prioritized in receiving booster shots because of their high exposure to the disease. Vaccine czar Carlito Galvez Jr. is open to adopt the COVID-19 booster shots for medical workers. However, the World Health Organization has yet to recommend booster shots due to lack of further data to back its efficacy. Diego.
Thank you, Asher Kadapan Jr. for that live report. The Department of Education continues to call on parents to enroll their children as the school year is set to start in the next 2 weeks. Meanwhile, a total of 120 public and private schools are being eyed for the implementation of pilot face-to-face classes once allowed by President Rodrigo Duterte. Janice Ingente reports.
The Department of Education has added 20 more private schools to be included in the pilot phase of physical classes in low-risk areas of COVID-19. Education Undersecretary Nepomuceno Malaluan said the DepEd initially presented to the Senate only 100 schools. However, Education Secretary Leonor Briones requested that 20 private schools be added. DepEd, together with the Department of Health, will be presenting the guidelines to the President next week.
Yun lamang pasok dun sa tinatawag na minimal classification among the 638 schools, yung lugar ang maaaring mag-qualify. When we say minimal risk, yan ay yung 2-week growth rate ng kaso ng COVID dun sa kanilang municipality na pinalolooban ay less than or equal to 0. And ang average daily attack rate nila of cases per 100,000 population ay less than 1.
The process of the limited in-person classes will be upon the approval of the President. Janice Ingente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippines today logged 20,310 more COVID-19 cases, pushing the cumulative tally of infections to 2,040,568. In its 4 p.m. bulletin, the Department of Health, or DOH, said the latest tally brought the country's active cases to 158,994. Among these active cases, 96.5% are mild, 0.92% are moderate, 1.1% are asymptomatic, 1% are severe, and 0.5% are in critical condition. The DOH said 6 accredited testing laboratories failed to submit data on time. Meanwhile, total recoveries rose to 1,847,701 after 7,710 more patients recovered from the disease. However, the death toll also climbed to 33,873 with 193 new fatalities. Meanwhile, the overall global COVID-19 caseload has reached 219,139,205, while the deaths have surged to 4,543,447, according to the Johns Hopkins University. The U.S. is the worst hit country with the number of cases and deaths at 39,552,739 and 643,702, respectively, according to the CSSE. In terms of infection, India follows with 32,903,289 cases and 439,895 deaths. In terms of deaths, Brazil comes second with 581,914 fatalities and 20,830,495 cases.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Philippine Health Insurance Corporation announced the second implementation of the debit-credit payment mechanism that covers received in-process claims from April 8 to August 9, 2021. The second wave of the DCPM still excludes claims that were returned to hospitals for compliance, denied, and under investigation for payment. Eligible health care facilities should submit a letter of intent and undertaking to the concerned PhilHealth office or branch. The Philippine Health Insurance Corporation's actuarial life is projected to last till 2027, as the state health insurer also estimates a net loss of 57 billion pesos this year. Ray Pelayo explains why.
Computing the collections against the obligations, the operation of the Philippine Health Insurance Corporation or PhilHealth will only last until 6 years from now. This projection transpired during a hearing of the House Committee on Good Government and Public Accountability on the agency's delayed releases for hospital claims. However, according to PhilHealth Acting Senior Vice President Nery Santiago, the actuarial life is based on projections, noting that it can still change due to different factors.
The assumptions can be different from what will transpire in the future po. For example, the assumption that is in the projection will depend on the subsidy coming from the government with respect to the premium contribution for the indirect contributors. And it will also depend on the rollout of benefit enhancement in the future.
PhilHealth is also projecting a net loss of 57 billion pesos this year due to the expected increase in COVID-19 claims. This is despite the agency's collection of around 87 billion pesos from premiums and dispensing only 52 billion pesos for payouts and accruals. Marikina Representative Stella Kimbo estimates that PhilHealth could earn around 40 billion pesos, including the income from its investments this year.
Explain to us why you will lose 57 billion for the entire year. That will mean losing 57 plus 97 billion in the next 6 months. I cannot imagine how that will happen.
For the second half of 2021, we expect a surge in terms of COVID claims. Because dito po nag-surge into 22,000, 16,000.
Madam, kahit mag-surge pa tayo, hindi ka malulugi ng 97 billion. Kasi 5% lang ng cases ang ma-hospitalize.
Kimbo is asking the committee to consult the Insurance Commission on the matter. Ray Pilayo, UNTV News and Rescue, we serve the people, we give glory to God.
The Commission on Audit will look closely on the transactions made by the procurement service of the Department of Budget and Management to the formerly Pharmaceutical Corporation after bagging billions of pesos in COVID-19 contracts. Nina Armilio details why.
The Commission on Audit emphasized during the budget deliberation in the House of Representatives that in its recent report, they found no problem in the procurement service of the Department of Budget and Management's inventory management. But COA Chairperson, Attorney Michael Aguinaldo, said he will still ask the resident auditor of the Department of Budget and Management to release its own findings on the transactions made by its procurement service to formerly Pharmaceutical Corporation.
Kasi po ang nangyari, a lot of these common use supplies, as they call it, were procured in April 2020 at a certain price range. Kaya lang by September of 2020, medyo nagbagsakan na po yung mga presyo. So the problem was they still had a lot of inventory in their warehouse na hindi nila na-dispose. Now meanwhile, itong mga regional offices, regional hospitals ng DOH, ayaw na kumuha sa PSDBM kasi sabi nila, napakamahal na nung sa inyo. We can just go across the street and buy it for 3-4 times less. So yun ang naging problema. It was an inventory management issue.
According to the COA chairperson, they will try to release the results of their own investigation within a month. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
The Commission on Audit has no jurisdiction over the Philippine Red Cross. COA Chairman Michael Aguinaldo has made this clear after President Rodrigo Duterte demanded the audit of the Philippine Red Cross following his accusations versus its chairman, Senator Richard Gordon.
Yes, we confirm we do not have the jurisdiction to audit the organization, yung Philippine National Red Cross. The only thing we can audit are payments made by PhilHealth to the Red Cross. But in that case, what we're auditing actually is PhilHealth in making those payments.
One of the responsibilities of COA is to examine, audit, and settle all accounts pertaining to the revenue and receipts of and expenditures or uses of funds and property owned or held in trust by or pertaining to the government. Senator Gordon, meanwhile, says it is an honor to be attacked for doing his job both at the Senate and the Philippine Red Cross.
This is really tragic. I think it is an attempt by the president to try and distract the people once again. You know, the matter at hand, sabi nga ni Senator Lacson, nagpapanik siya. Ang pakiusap ko lang, Mr. President, is huwag mo ko awayan para hindi kami makapag-focus doon sa dapat namin paghandaan at para mahuli natin yung talagang nangungulimbat. Sabi niyo, bawal ang korupsyon sa inyo. I stand behind my record and the good work that I and the Red Cross have done.
Several senators have responded to the recent tirade of President Duterte that lawmakers should not investigate ongoing programs. Meanwhile, one senator hopes that the president will stop defending the members of his cabinet who are facing allegations. This report will tell us why.
The Senate leadership has defended the Senate Blue Ribbon inquiry on the deficiencies found by the Commission on Audit on the Health Department's use of COVID-19 funds. This as President Duterte took a swipe at senators once again, saying that they should not investigate programs that are ongoing. For Senate President Vicente Soto III, the Senate is simply doing its job. Soto says government agencies have nothing to worry about if they are doing nothing wrong. He also noted that the Senate is investigating past issues and not the ongoing ones. Senator Risa Ontiveros also shares the same sentiment. She believes the processes to ensure accountability should not be reduced even if the country is in a state of emergency. Senator Panfilo Lacson, for his part, cannot see how anybody, even the president, can influence the Senate on an issue involving public funds. And for Senator Manny Pacquiao, he hopes that the chief executive will stop defending his men who are facing allegations.
Hindi dapat natin depensahan o ipaglaban kung ano yung mga anomalya na ginagawa nila. Kaya nga nakiusap ako sa ating Pangulo na hayaan niya yung mga sekretary niya na imbestigahan in aid of legislation para mapatunayan na kung may kasalanan sila o wala. Ito ay demokrasya naman kasi tayo. So sana ang Pangulo natin ay huwag magalit. Ginagampanan lamang namin ang aming trabaho as a legislator.
The Senate Blue Ribbon Committee will continue its inquiry on Tuesday, September 7. Jardine Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screens and ring the bell for notification. You may also follow us on Facebook.
For the news abroad, the Australian government has granted new powers to the Australian Federal Police. This gives them authority to access and modify any personal social media account of an individual in Australia. Nerissa Dando will tell us why live. Nerissa?
Good evening, Kat. To combat organized crimes, the surveillance legislation, or commonly known as Identify and Disrupt Bill, has been approved by the Australian government to hunt down criminals, traffickers, and pedophiles lurking in the dark web. This gives the Australian Federal Police, or AFP, and Australian Criminal Intelligence Commission, or ACAC, the capability to collect information from the dark web and criminal networks and to disrupt cybercrime activities. Moreover, they will be granted the ability to take over online accounts for the purpose of gathering evidence without the person's consent. According to Home Affairs Minister Karen Andrews, the 290 arrests made earlier this year confirmed that organized crimes rely on the dark web to hide their schemes. Meanwhile, AFP Commissioner Reece Kershaw assured the public that they would use this power responsibly, as Australia is now the third largest patron of child abuse materials. Kath?
Nerissa, how well did the public receive the new law?
Privacy advocates and critics are now worried that this bill would turn the nation into a surveillance state. The petition has been raised to get this bill repealed due to intrusion of privacy. Moreover, according to the human rights lawyer Kieran Piender, this bill could be potentially used to monitor the journalists. So the power should So the power should have been constricted. Kath?
Thank you, Nerissa Dando, for that live report. Australia's travel ban will be extended for another 3 months from September 17 to December 17 this year. This is part of the country's human biosecurity emergency plan that kicked off in March 2020. The imposed ban restricts Australians from leaving the country without an approved travel exemption from Australian Border Force. For international non-citizen travelers wanting to enter Australia, a travel exemption for entry is required to be approved. Based on the country's national plan, travel ban can be lifted for vaccinated Australians once the country reached 80% of vaccination for 16 years old and above. Meanwhile, Queensland and Western Australia states have both refused to commit to opening up their state borders even if 80% target is met. Japanese Prime Minister Yoshihide Suga has expressed his intention to resign this month amid criticisms over the government's response to COVID-19 pandemic. This came just under a year after he took office and as his ruling Liberal Democratic Party prepares to hold its presidential election on September 29. Suga was quoted by a participant at an extraordinary meeting of LDP executives as saying he will serve out his term through September 30. A source at the Prime Minister's office said Suga hit a snag in his plans to reshuffle the party's executives, which he hoped to carry out on Monday. WhatsApp Messenger platform, parented by Facebook Incorporated, has been fined for over 225 million euros. Joselito Liquido will tell us why live. Yes, Joselito?
Kath, WhatsApp has been found to have breached many provisions within the European Union data protection law, such as handling of its users and non-users' information and the manner of which data exchange occurs between WhatsApp and Facebook. The company provided a statement disagreeing with the conclusions, claiming that the penalties are unfair, justifying that they have been providing transparency since 2018. The European Data Protection Board wanted to impose a higher fine, but objections from EU counterparts surfaced relating to appropriateness of the envisaged corrective measures. WhatsApp has since then been advised to take immediate action following appropriate data processing communication, taking into consideration clearer communications between them and their users. Kath?
Yes, Joselito, how has this impacted the WhatsApp company?
Kath, this had been added another loss to the company, as in November 2020, they suffered 11.2 million euro loss, needing to pay 77.5 million euros for an investigation connected to their privacy policy. Since January, more pressure has been put on the company as their policy exchange continued to be delayed, with backlash left and right regarding the user data and company collects. Kath, back to you.
Thank you, Joselito Liquido, reporting live from Malaysia. Sensory tools such as sour lollies and fidget toys help mothers who are struggling to bond with their babies. Annie Mancilia tells us why live. Annie?
Good evening, Kath. Gold Coast University Hospital researchers have found that sensory tools such as perfume, bubble wraps, herbal teas, and even sour lollies help reset the nervous system of women who are experiencing postnatal depression or PND. Their study found 40% of women had extremely high levels of sensory sensitivity after giving birth compared to just 4% of the general population. These extreme levels of sensitivity can cause mothers to become easily overwhelmed by various stimuli, which can lead to poorer bonding, lower parenting confidence, and decreased happiness when playing with their baby. Struggling moms who have undergone the sensory modulation treatment using a set of tools based on their sensitivity profile have tremendously improved. Reports of reduced self-harm behavior, feeling closer to their babies, and the fact that they can reset whenever they are overwhelmed prove the study a success, which has garnered the interest of the international medical community. Kath, the sensory modulation treatment is actually non-invasive. and recovery-oriented. Moms struggling with PND can use the sensory tools at the comfort of their home whenever they need it. These sensory tools are all based on their sensitivity profile, which can be assessed during the onset of the treatment. Kath?
Annie, does the study involve any kinds of invasive procedures to help moms with PND? Thank you, Annie Mancilia, for that live report. And those are the reasons behind the news in other parts of the globe. I'm Kat Dumaraos, live from Bangkok, Thailand. Good evening.
Citizen-led bike and pedestrian project titled Metro Manila Counts conservatively estimates that 500,000 cyclists are using the roads of the National Capital Region. Let us take a glimpse of some of its findings and the importance of generating more data to collaborate with the LGUs and national government efforts towards sustainable mobility in this episode of Bisikleta. And before we close, we will leave you with a final word, giving glory to God. From the book of Hebrews, chapter 13, verse 5. It says, "Let your conversation be without covetousness, and be content with such things as ye have. For he hath said, I will never leave thee, nor forsake thee." And those are the reasons behind the news, September 3, 2021. Reasons we deliver to you as they unfold. I am Herlene Delgado.
Because we need to know, we will always ask why. I'm Angelo Castro III. We serve the people. We give glory to God.
Well, sa ngayon po, parang hindi po doable yan. Dahil nakikita naman po natin na ayaw nating lalo pang dumami ang hanay ng mga nagugutom. We are aiming for total health. Bawasan ang pagkalat ng kaso at bawasan ang hanay ng mga nagugutom.
Yes, we confirm we do not have the jurisdiction to audit the organization, yung Philippine National Red Cross. The only thing we can audit are payments made by PhilHealth to the Red Cross. But in that case, what we're auditing actually is PhilHealth in making those payments po.
This is really tragic. I think it is an attempt by the president to try and distract the people once again. You know, the matter at hand, sabi nga ni Senator Lacson, nagpapanik siya.